first off, we're going to use a gait belt that we have here in the hospital where we place it around the waist of the patient. You don't have to have a gait belt just like this. You can use a standard belt at home and just place that around the patient's waist. It just gives you a better place to hold on if the person needs stability. So there we go. Pretty snug. And then I can tuck in the extra loop here. Okay. I guess we can have you stand up the correct way. So Anna presses up using the crutches as a cane and the rail of the chair. For purposes of this video, Anna's right leg is the involved leg, whether she's had a hip surgery or a knee surgery or an ankle surgery. And she's going to be showing us non-weight bearing on her right leg. We'll do stairs this way without railings, as if that's what you have at home. So we are simulating navigating stairs as if there were no railing at all. Preferably, having at least one railing would be the best. Anna's showing us non-weight bearing on her right leg, so she's not allowed to put any weight on that right leg going up the stairs. So I'm guarding on the downside of the steps. I'm holding onto her belt. She's going to put weight to her arms and then bring her left leg up to the step, and then bring the crutches to meet that leg. Weight through the arms, step, and crutches to meet. Notice that she's not hopping, but that she's just shifting her weight. When she goes down the stairs, her injured leg is in front, so she doesn't bump it on the steps behind her. I'm still on the downside of the steps to guard her, and she's going to bring her crutches down and then meet that left leg. You definitely want to lead with the crutches down, or else it's like you're going pole vaulting down the steps. So keep in mind that if the patient needs some assistance coming down, you really want to have a good grip. For example, many times when coming down the stairs, the patient will lose balance either backwards or forwards. So Anna, I'll have you come down a step. Ideally, putting the crutch near the front of the step she's coming down to, so come a little bit more forward, will help with her balance coming forward. She's going to hop down. And so right now she just lost a little balance coming back, and I grabbed her belt and kept her steady. And then do it again. Up, and again, she lost her balance a little. So you want to be ready just in case they do have trouble. So next we're going to simulate doing stairs in the case where the patient is weight bearing as tolerated. So Anna's right leg is weight bearing as tolerated. She's allowed to put weight on it, though it might not be comfortable for her at times, or she might not be able to rely on it entirely. So we'll do stairs as if there were no railing, and Anna's weight bearing is tolerated. I'm guarding on the downside of the steps. She's using her crutches for support. She's going to want to go up with her strong leg leading to help pull her up the step, and then she brings the crutches to meet. Up with the strong leg, meeting with the involved leg, and crutches meet. Up with the strong, involved, crutches. Good. So now we're going to come down the steps. Again, Anna's weight bearing is tolerated, and she's on stairs without railings. She's going to go down with the bad leading, though crutches should start first. Good. Crutch, bad, good. Crutch, bad, good. Crutch, bad, good. So a good way to remember how to do the stairs is up with the good leading, because good goes to heaven first. Down with the bad leading, because bad goes to hell first. Not very politically correct, but it helps people to remember. So now we're going to simulate navigating stairs with one railing. Again, you could either use the right or left railing depending on what you have. Anna's going to show you on the left railing so that you can see better. So she came all the way up to the stairs using her crutches. She's gathering them up on the opposite side from the railing that she's using. And she's going to go up with the good leg leading. and then match her injured side to that step. Okay, pause here for a second, Anna. So she's doing really well with that. If your leading leg is a little bit on the weak side, you might have to step up with the good leg, match your involved leg, and then bring the crutches up. Good. All right. So we are simulating going down the stairs with one railing, and Anna's weight bearing is tolerated on her right leg. So she's going to go down with the crutch leading first. I'm guarding on the down side of the steps, and she's going down with the bad and meeting her good leg. Down with the bad, meeting the good. Down with the bad, crutch, bad, good, good. And some people get confused by going down with the bad leg first, but it does make sense because her good leg is doing the work to lower her down with control. The way Anna just showed us using a crutch on one side, you could also envision using a cane on one side. It's the same sequencing with the legs. So now we're going to show a unique way of navigating stairs using a tub bench seat. We've adjusted, and this is in the case of a patient who's non-weight bearing. We've adjusted the tub seat bench so one end is full length and the other end is as short as it can go. And these can be found at most pharmacies, drugstores, and general places like that. So Anna's going to use her walker to get to the stairs. Okay. And then I'm going to place the seat on the first step. Okay, and she's going to sit right down on the tub seat. She's going to step up her good leg, and then she's going to stand up using the railing, and I'm going to move the seat up to the next point. And we just keep doing that the whole way until the last step where she pivots in to the house or onto the next floor. To come down, it's the reverse order. She places her foot down one step and then pivots onto the tub seat. She brings her foot down, stands up. I move the seat down. Good. And then the last step, she just stands up and off she goes. So next we're going to show how to get up and down from a curb or platform step. Very often this happens if there's just one step to get into the house. So Anna is showing that she's non-weight bearing on her right side. She's using a walker. She brings the walker all the way up to the platform step, so her toes are pretty close, because then she's going to lift and place her walker up onto the step. Again, I'm guarding on the down side of the step, and she's going to basically do kind of a hop two step to meet the walker, and I'm going to help stabilize it here. Good. She puts most of the weight in her arm, so it's a controlled hop. For coming down, she's again going to step right to the edge of the step, place the walker down. I'm guarding on the down side, her involved legs in front, and she just steps to the floor, putting weight through her arms. That's for non-weight bearing. So now we're simulating stepping onto a curb or platform step using a walker when the patient is weight bearing as tolerated. So Anna's going to step her feet up nice and close to the step. She'll lift and place the walker onto the step. I'll help stabilize it if needed. And then she's going to step with her good leg up, and she'll match her involved leg up. To come down a curb step, she's going to lift and place the walker down I'm going to help stabilize, and she goes down with the bad leg, the surgical leg, and then steps her other leg to meet. Now we're going to show one other way to navigate a curb step where Anna is non-weight bearing or partial weight bearing. We're going to show it non-weight bearing, so that's a little bit harder. Some people have difficulty hopping up forward onto the step, so we're actually going to turn around and go up backwards. So Anna backs right up to the step. She's actually just going to put the weight through her arms and then place her good leg up onto the step and then bring the walker to match. Make sure you keep your hands on as needed for balance. So now we're going to show how to do one step in, like a platform or curb step, such as one might have just to get into the house, using the sit-in technique. So Anna's going to show that she's non-weight bearing on the right side. She's turning her walker. This could also work with crutches, but she's turning her device so that she just sits right into the chair, and then she can just pivot in, and having her walker placed back inside the house. Not a perfect space right now. Then she can just stand up and she's in the house. So keep in mind you can do this with crutches or a walker. Ideally, the chair that you would use would not have wheels and it would not have armrests.
I'm going to be going over the safest technique for getting in and out of a vehicle. If you have the option or choice of vehicles, we do recommend a sedan versus a higher vehicle like a truck. We'll be going over the safest way for getting in and how to set up the vehicle. If your chair has options for adjustments, you should make them. If you're able to push the seat back as far as possible to give the patient as much leg room, that would be very beneficial. And the same for the height of the chair. If the height of the chair is able to be adjusted, adjusting it a little bit higher to get in and out will make it a lot easier for the patient. When you're getting into the vehicle, make sure that your driver brings the vehicle up to a flat surface. You want to try to avoid any curbs or any sloping areas. When the patient is brought down after surgery, they will be coming down in a wheelchair. Always make sure that the brakes are locked to ensure safety. Also, instruct the patient to push from the surface they're sitting on, and in this case, in the wheelchair. So we'll have our patient push from the arms of the chair to push up to then use the rolling walker. We're going to then walk a distance over to the car. You want to ensure that there's enough of a distance that the wheelchair isn't too close to the car and that the patient has enough area to turn with the walker. You want to have the patient turn around so that way they enter the vehicle going in backwards. You want to make sure that they reach back for the seat of the vehicle with both hands and sit all the way down into the car. Next, you're going to move the rolling walker to make sure it's out of the way. There are a couple different ways that the patient can bring their legs into the vehicle. The patient can hook their good leg underneath the operative leg and swing their legs into the vehicle. The support person can help with that anytime. Another method of getting into the vehicle can be one leg at a time and using your hands to help support the operative leg. So if you reach down to your thigh, bend down and lean back when you lift your leg up into the vehicle, that will make it a little bit easier. And if the patient needs a little bit more support, the driver can come down and support the leg. You want to ensure that the patient is ready, so have them count to 3, and then on 3, lift the leg into the vehicle.
Okay, ready? 1, 2, 3, lift.
Another recommendation for getting in and out of the vehicle safely might be going into the back of the vehicle. Some options as to why this might be a safe option can be because you might have a long distance drive back to your house. You also might have decreased range of motion and not be able to fit into the front seat. When choosing the back seat, you want to think about which leg is the operative leg. In this case, we have the right leg, so we want to be getting into the back seat of the passenger side. If the patient were to experience any bumps, that leg is supported by the back of the seat as well as the seat itself. If a bump were to occur and the left leg were to fall down, it wouldn't be as painful for the patient. So you want to get into the vehicle the same way, backside going in first. Back up, hold on to anything that is a sturdy surface, and then you are going to slide in to the back seat using your upper body strength. If the fabric of the seats are leather, it's a lot easier to slide. If the seat fabric is a fuzzy material or causes a little friction, you can always put a trash bag underneath the patient's backside to help with sliding into the back of the seat. I'm going to be going over the safest way for getting in and out of a tub with a seat, using a seated technique. This bar is to indicate the height of the tub, making sure that the patient is able to clear that lip of the height, getting in and out of the tub using a seated technique. The seat that we're going to use is going to be all the way inside the tub. So the patient will be backing up to the lip of the tub, reaching back for the seat, sitting down all the way onto the shower seat that is inside the tub. We're going to have our patient come over with the walker, back up to the seat. Make sure you feel the lip of the tub, reach back for the back of the seat and the seat here. That will ensure a nice, safe landing. You're going to move the rolling walker out of the way. And next I will be showing you how the patient will be getting in and out of the tub. A couple different options for being able to lift the leg over the lip of the tub may be using the good leg to hook underneath the operative leg and support the leg and bringing it into the tub. Your support person, you can help at any point in time as well. Option 2, the patient will be supporting their leg with their hands, but first you're going to move the non-operative leg, lift it up over the lip of the tub. Now the patient will lean forward, support their thigh, and lean backwards while they lift their leg up over the tub to ensure the clearance of the tub lip. Perfect. Getting out of the tub, you want to ensure that the patient pushes from the seat and does not pull up on the walker. So they're going to push from the shower seat, then grab onto the walker to ensure that the walker does not tip. Next, I'll be going over the best technique for getting in and out of the tub using a standing technique. So the patient's going to be coming up with their device, in this case the rolling walker. You want to get as far close to the wall as possible. The walker is going to stay outside of the tub. When you get into the tub, you do not want to face the tub going forward. You want to make sure that you're facing one of the side walls. One of the side walls are going to help give you some support for your upper extremities. In this case, we are going to be getting in facing the back of the tub. So the patient is going to bring their hands up to the tub wall. They can move the walker so it's out of the way. Next, they're going to be getting up nice and close to the tub lip. They're going to be lifting this leg first up and over the tub lip. If the patient does not take a big enough step, then instruct the patient to take a smaller step with each leg to ensure they do not step on the other leg. So we'll have this patient lift their operative leg over the tub lip, and now they're in the shower. In this scenario, the shower head is on this side and the patient can use the wall for support to turn around for showering. If you have a grab bar to use, make sure that it is a grab bar that is installed properly. You want to make sure that the grab bar is in the studs of the walls. A grab bar is beneficial for having hand support to step up over the lip of the tub. In an ideal situation, the grab bar would have a non-skid surface to prevent any slipping, and a diagonal would ensure different heights to make it easier for the patient to hold on to. When you install the grab bar, ensure that the height works for the patient. Have the patient stand, and you want to have the patient be able to hold the grab bar and have the angle of the arm be at a 90-degree angle. Now I'm going to be going over the best and safest technique for getting in and out of a shower stall. If you're getting in a standing technique, you want to bring yourself or have the patient bring themselves to one of the side walls. In this case, we'll be demonstrating the back of the shower stall. You want to ensure that the patient has something to hold on to if you do not have a grab bar. If you're using the wall, you want to instruct the patient to lean onto the wall and sidestep their legs up and over the lip of the shower. You want to take another small step to ensure that the next leg does not come down or cross when you're stepping all the way into the shower. Then the patient would be able to hold on to the wall to turn all the way around to face the shower head for showering. Next, we're going to be demonstrating the safest technique for getting into a shower stall using a seated technique or having a shower seat. So you want the patient to back up to the lip of the shower and get as close as they can. The patient is going to let go of the walker and reach back for the shower seat. We'll push the walker out of the way. These techniques will be the same as getting in and out of the tub, just now it'll be a smaller lip height. The first option is taking your operative leg and hooking underneath to support that leg to bring it over the lip of the shower. The next option will be to use your hands, so instruct the patient to lean forward, support their operative leg, and then lift that leg over the lip.